Are you feeling constipated? Constipation, a common condition characterized by fewer than 3 bowel movements per week, can be a challenging problem, often resulting in hard, dry, and small stools that are difficult to pass. This condition affects millions of individuals worldwide, with women being particularly susceptible. But don't worry, you're not alone in this. We've all been there at some point, and it's nothing to be embarrassed about. This video will guide you on how to deal with constipation, so let's dive in. The first thing you can do is to make some dietary changes. Now let's talk about food, specifically the type of food that can help you get things moving again. Yes, I'm talking about fiber. Fiber is a type of carbohydrate that our bodies can't digest. This might seem like a bad thing, but it's actually quite the opposite. Because fiber isn't broken down in our bodies, it adds bulk to our stools. This means that it can help soften your stools and make them easier to pass, which is exactly what you need when you're dealing with constipation. There are 2 types of fiber, soluble and insoluble. Soluble fiber dissolves in water, forming a gel-like substance that can help soften stools. Foods rich in soluble fiber include oats, peas, beans, apples, and citrus fruits. On the other hand, insoluble fiber doesn't dissolve in water. It adds bulk to the stool and can help food pass more quickly through the stomach and intestines. Foods rich in insoluble fiber include whole wheat bread, brown rice, legumes, carrots, and cucumbers. But fiber alone isn't the solution. It's also essential to stay hydrated. Water plays a crucial role in digestion. It helps dissolve fats and soluble fiber, allowing these substances to pass through more easily. Not drinking enough water can lead to dehydration, which can result in harder and more difficult to pass stools. So make sure to drink plenty of water throughout the day, and not just when you're thirsty. And don't forget about fruits and vegetables. They're not only packed with fiber, but also contain a high water content. Eating a variety of fruits and vegetables can provide your body with the fiber and hydration it needs to keep your digestive system running smoothly. In conclusion, dietary changes can go a long way in relieving constipation. By increasing your fiber intake and staying properly hydrated, you can help regulate your digestive system and alleviate constipation. So, remember to eat plenty of fiber and drink lots of water. Next, consider some lifestyle adjustments. Small changes can often have a significant impact on your health, and constipation is no exception. Let's start with your posture. Believe it or not, the way you sit on the toilet can influence your bowel movements. Traditional Western toilets aren't designed with the natural human elimination process in mind. Squatting, surprisingly, is a more natural position that aligns the colon for easier passage of waste. So, adjusting your posture to mimic this squatting position, perhaps with the aid of a footstool or a specially designed toilet stool, could make a world of difference. Moving on, did you know that certain medications could be the culprits behind your constipation? From painkillers to antidepressants, some drugs can slow down your gut movement, leading to constipation. It's always a good idea to take a close look at your medications if you're dealing with persistent constipation. If you suspect your medications might be the cause, don't just stop taking them. Instead, consult with your healthcare provider. They can guide you on possible alternatives or adjustments to your dosage. Lastly, let's talk about massage techniques. Specific abdominal massages can stimulate your intestines, improving their movement and aiding in waste elimination. These massages don't require any special tools or skills. With a bit of guidance, you can perform them at home, making them a convenient and cost-effective relief option. Remember, sometimes it's the small tweaks in our daily routine that can bring about the most significant changes. The benefits of adjusting your toilet posture, checking your medications, and trying massage techniques are evident. By incorporating these lifestyle changes, you may find that constipation becomes less of a nuisance, improving your overall quality of life. Small changes in your daily routine can go a long way in relieving constipation. If dietary changes and lifestyle adjustments aren't enough, there are medical interventions that can help. Let's dive into some of these options. Over-the-counter remedies such as enemas or suppositories can provide immediate relief. These work by softening the stool and stimulating bowel movement. However, they should only be used occasionally and not as a long-term solution. In addition to these, prebiotics and probiotics may be beneficial. These supplements work by restoring balance in your gut, promoting healthy digestion. Prebiotics are a type of dietary fiber that feed the good bacteria in your gut, while probiotics are live bacteria and yeasts that are good for your digestive system. Now, it's important to note that while laxatives can provide short-term relief, they should not be relied upon long-term. These are best used as a temporary solution when other methods have proven ineffective. For severe cases of constipation, there are prescription medications available. These include linaclotide, lubiprostone, and plecanatide, which work by increasing the fluid in your gut and speeding up bowel movements. Lastly, in some rare instances, surgical options may be considered. This is typically reserved for structural issues or severe cases of constipation that have not responded to other treatments. Remember, it's crucial to consult with your healthcare provider before starting any new treatment. Let's quickly summarize what we've covered today. Constipation, a common issue affecting millions, is characterized by less than 3 bowel movements a week and can cause discomfort due to hard, dry, small stools. But fear not, there are several ways to combat this issue. Firstly, dietary changes can bring significant relief. Increasing fiber intake and staying well hydrated can help regulate bowel movements. Then, lifestyle adjustments, such as improving toilet posture using biofeedback or massage techniques, and ensuring medication isn't causing the issue, can also be beneficial. In some instances, medical interventions might be necessary. Short-term use of laxatives, prescribed medications like linaclotide, lubiprostone, or plecanatide, or even surgical procedures for severe cases or structural issues are viable options. Incorporating prebiotics and probiotics into your routine can help restore balance in your gut. But remember, it's crucial to address constipation promptly to avoid complications like hemorrhoids, fissures, or rectal prolapse. Remember, if you're dealing with constipation, there are plenty of steps you can take. Don't hesitate to seek medical advice if you're struggling. Thanks for watching.